I'm Wendy Wilson, and I'd like to welcome you to a special edition of Realizing Potential. Today, I'm honored to engage in a conversation with two of Albany State's very accomplished and recognized alums. They have made significant strides and an impact in the healthcare industry, in the medical field, and really are noted on an international scale, specific to their work as they address the pandemic that we are currently facing and their efforts to fight the coronavirus, and here to discuss the vaccine itself and the need for all of us to take advantage of that. Without further ado, I'd like to introduce to, I know, only a very small group of individuals, Dr. Derek Hurd and Dr. James Eddie Black. Gentlemen, how are you today?
Well, thank you.
Good,
Doing well, thank you.
Good. Dr. Black, because you showed up on my screen initially, I'd like for you to share with the viewers, and I know it's just a small number, your history with the community, specifically Albany State University, and what led to your interest to pursue medicine.
As you mentioned, I grew up in Albany, and I remember back in second grade, our teacher going around and asking what do you want to do to grow up, and a lot of people were saying policeman, fireman, professional athlete, and I said I want to be a doctor. And what was significant is that that teacher told me, well, I don't think you can do that. But I forgot, and that kind of spurred me on, and that's all I ever wanted to be. And of course, attended local high schools, public high schools, graduated from Doherty High School, Albany State University. I guess it was Albany State College way back then. Then attended Ohio State, and after time in the military and working down in Tampa, I chose to return home, and it was the right move, and I'm glad to be home.
Very good. Very glad to have you. Thank you so much. And I'm so glad that you did not listen to that teacher. I unfortunately hear that story so often, and it quickly reminded me of a story that Malcolm X often shared about how an instructor at one time discouraged him for pursuing law school. He said he wanted to be an attorney, and he said, no, people like you should pursue something much more noble. Carpentry, I think, is what was suggested. So I'm glad you didn't listen, and the world is better for it. Sir, we can't leave you out. If you can join in the conversation, Dr. Hurd, and share with us your history as it relates to your thought, the inception of you deciding to pursue medicine. And of course, you are an illustrious alum of Albany State. Share a little bit with our viewers about that process.
Well, unlike Dr. Black, I came to the realization that I wanted to be a physician a little bit later in life. I was actually getting ready to attend Albany State at that time. And so you had to declare a major. And so I spoke with my parents about it, and I thought I wanted to go to law school, but they said, maybe you should consider medicine. I guess they thought I couldn't be a good lawyer. And so I became a pre-med major at Albany State. I graduated from Albany State in 1995, and I went on to the Medical College of Georgia in Augusta, and graduated from there in 99, came back here to Albany to do my residency in family medicine, and have been in practice here ever since then. And I did not mention that I'm a 1991 graduate of Lee County High School. So I'm a local boy as well.
Very good. Very good. So what I love about you gentlemen is that you certainly have demonstrated and continue to demonstrate that all is achievable. It's just a matter of commitment and coupling that with some passion and some dedication. So thank you for that. We'll circle back in terms of what you love about the profession that you're in. But I imagine over the last year, you have experienced challenges and just embraced or found yourselves in some situations that were just unfathomable or unforeseeable. And specifically, we're going to talk about the pandemic and your role. Speak to us in terms of what our current numbers are looking like in this community. And then we want to segue a little bit into, or not a little bit, but we want to segue into the vaccine effort, what your specific roles in, and then speak to the community as to why it is important that we pursue. Dr. Hurd?
Okay, well, I will love to speak on the vaccine effort because I've been a little bit more involved with that. Dr. Black has been one of our champions in terms of the COVID response. And so I'll let him speak specifically about what our COVID numbers are looking like here in Albany.
Perfect.
So in terms of our vaccine effort, Phoebe has been a huge part of our community's effort, along with Albany Area Primary Health Care and the Department of Public Health. here in town. We have been vaccinating patients here in Albany since the beginning of, actually since the middle of December. And we started out because of the state mandate with healthcare workers, and then first responders, and then those 65 and older. And so we've been doing a good job in vaccinating our community. I would say, however, as a whole, the state of Georgia is a little bit below where some other states are in the country. And I think that is multifactorial. First being the way that we are rolling out the vaccine. Like I said, you have some states that are rolling out to all comers that want to come. Our state has been a little bit more deliberate in that we are following a kind of set of rules in terms of who can get it, because we're going after those that are most vulnerable first. But even with that, I'm still concerned about the vaccination in the minority communities for Black and Brown people. The fact that we have been a little bit reluctant to get vaccinated, and that goes in a lot of different ways. But I'm sure we'll talk about that a little bit later. But I'll let Dr. Black now speak to our COVID numbers that we're seeing in our community.
Thank you. Dr. Black?
Thank you so much. And I think that, to put it in the context of where we are currently, I guess it's also important to know where we have been. And, given our initial response a year ago, we saw our numbers tremendously high in the community and not so much around the country. And at one time, we ranked number 4 in the world behind Wuhan, China, New York City, the Lombardy region, and Italy. And in Albany, Georgia was number 4 in terms of death. And I guess history has shown, or recent history has shown us, that we were not so abnormal just very early in response to the rest of the country and the rest of the world began to be experienced early on. Since that time, going into November, I recall that our numbers were the lowest they had been. We were down to about 25 patients that were hospitalized, but then we had successive holidays with Thanksgiving, followed by Christmas, followed by New Year's celebrations. And we saw those numbers balloon up, not only locally, but around the world. Only recently, the last few days, we have seen consistent decrease in the number of hospitalized patients, and also decrease in the number of percentage of positive tests. But those are 2 markers that we kind of keep track of in order to keep an eye on the severity in the community. So it's kind of a double-edged sword. On the one hand, our numbers are coming down, but our numbers were extraordinarily high. So we're not nearly out of the woods yet, but we're seeing some improvement. My concern is that right around the corner is spring break, and that we may see some uptick in activity when people choose to travel and get together, as they have done over the holidays.
Well, let me insert that Albany State was very mindful of that, and we made some adjustments as it relates to our spring break. So we've the traditional, of course, is to have a week off, and then students will then leave, and then, of course, return to wrap up the semester. And we've done something different under the leadership of President Frederick. We have segmented those days, and so they will span from, we had our first one beginning of this month, and they will span the rest of the semester. And so we have no instructional days. And so that was to certainly support efforts to minimize a transmission and to keep our students safe. So we're encouraging to stay on campus that day, but have incorporated some activities that support mental health and wellness, and then again, underscoring the need to minimize transmission and certainly exposure. So we're doing our part in that regard. Delighted to hear that those numbers have decreased. Of course, the concern still remains that the virus is still out there, and we want to minimize, certainly play a role in alleviating that exposure and then transmission. I don't want to discount the reality that many Black and Brown people have at the forefront of their minds in terms of our history as it relates to healthcare practices, access to it, and the negative impact that so many marginalized communities have faced. Thus, the apprehension of this taking the vaccine. And Dr. Hurd mentioned that early on, that the numbers are still low, and we need to improve upon that. I'd like for both of you to contribute to that thought, your conversations with people regarding, and how do you respond to at times what has been viewed as medical apartheid in many instances for those that do not or have been denied or abused in some cases as it relates to access to proper health care?
Well, Ms. Wilson, I will tell you, this problem is a twofold problem, as I think I mentioned earlier. One, we have the dark history that our country has in terms of its treatment of African Americans in the medical community, whether that was experiments that we all know about in terms of the Tuskegee experiments that were done with syphilis, but we also even go back further than that to the father of modern gynecology and the experiments that were done on African women, African slave women then, and how that bore out what is modern gynecology, but the experiments were done on our people. Correct. And so there is some mistrust and misgiving in our community. So that's part of the problem. The other issue, and I deal with this in my job as medical director for primary care, is the social determinants of health that we have to deal with also. When you talk about an apartheid in terms of healthcare, we see that a lot of Black and brown people don't have necessarily the same access to care or the same access to quality care that other individuals do. And that's partly because of geographics, where they live, their ability to get access to that care, and then the type of care that they're able to get access to, even when they do get access. I am proud of our community in the sense that along with our organization with Phoebe, I think we do a great job in terms of making sure that access is open to everyone. And then we also have other partners in the community like Albany Area Primary Health Care that also give patients access to care and access to care in their neighborhoods and their communities. So from that regard, we need to make sure that that patients understand that, listen, you will have access to care. Now, how do we work on some of the myths that surround getting vaccinated and some of the fears that go with being vaccinated? Well, I will tell you, Dr. Black and I both have been vaccinated. We're part of that 1A group of people that need to be vaccinated because we're healthcare workers. I'm still alive. I haven't grown horns out of my head. I don't have a tail coming out of my back. I don't have a microchip that has been implanted in me and the government is now watching me every day. These are things that people think and people hear. And I've heard this from patients that there is that concern, but those things are just not true. I would say that we need to be careful about where we get our information from. Because you can't trust all the information that you hear. There's a commercial a few years ago that joked about, well, where'd you get that from? It must be true. Well, I got it from the internet. Well, no, not everything on the internet is true. So I would say that you need to first speak to your primary care provider because they're going to give you the most up-to-date information. And if you don't have a primary care provider, you need to get one, not just because of COVID, but just because of health in general. But even then, if you don't have a primary care provider, go to websites that are reputable. Go to cdc.gov. Go to National Institutes of Health.gov, Mayo Clinic, Cleveland Clinic, Harvard Medical. These are reputable sites that will give you good information that is up to date and that's easily digestible for non-medical people. And so again, just be aware that we are doing the best that we can in our community, but it's going to take the public's trust in us and people like myself and Dr. Black, who are from this community, who are part of this community, who've grown up here, to tell you that we're going to give you the best advice available.
Outstanding. Dr. Black, will you share what are some of the conversations that you're having with the greater population who specifically those individuals that are very apprehensive and concerned about the ramifications or any possible long-term ill effects of taking the vaccine and all of that based upon our history?
Well, and to echo what you said, we have some things in medicine and in science that we are not particularly proud of, that were actually, quite frankly, cruel and inhumane, that have been done and performed upon our people. And I think the first step is acknowledging that those things have happened in the past, not trying to hide them or to explain them away. They happened, but also to ensure people that there are people like Dr. Hurd, like me, and thousands of others that are keeping an eye. We're aware. And we're going to make sure to the best we can that those things never happen again. But we do have to understand the mindset and the history, and that goes into the decision-making of people. One of the first things I like to tell people is I'm happy that they are taking an interest in their health and things that are going to be done. And so I welcome the conversation. But along with the access that Dr. Hurd mentioned, I think one of the other things that they don't have access to is people like Dr. Hurd or like me that can answer questions that they have. So recently, Dr. and I have done town halls on Facebook, and now I'm actually going around the groups, no matter how small or how large. When they make the request, I do my best I can to accept and to give them the opportunity to ask questions, to talk about things that they've heard in order to spell some of those abnormal fears that people have. And I've not knowingly tried to convince anyone. If they ask me, should I get the vaccination? I don't tell them yes or no. I give them as much information as I can, and I follow that up with, I got vaccinated, and I encouraged my mother and my sister, who's also in medicine, to get vaccinated. And for those people that know me, there are no more important people to me in the world, and there's no way I would recommend that they do something I was uncomfortable with. So rather than try to convince somebody, tell them what they should do, I'd let them know my decision-making and how comfortable I am in the safety of getting vaccinated. And I like Derek Chris said, I mean, I believe I was one of the first, if not the first, in this part of the state to get vaccinated. And not that I feel that I am important, I am part of the at-risk group, but it was also important to let the community know that I would not ask them to do anything that I would not do myself, or know something I did not feel was vitally important to our survival of this disease, and also doing everything we could in order to protect ourselves.
Excellent. Gentlemen, if we may, I'd like to take a brief break, come back, and if we could discuss the composition of the vaccine. One of those misnomers or myths out there is that they actually inject you with it and on it. And so you all are certainly the medical experts. If you could just educate the public once we return back, I'd be happy to learn something myself. Viewers, we'll be right back. Thank you so much for joining us for this first portion of Realizing Potential, and we'll be back shortly.
Georgia needs you to answer the call. The Georgia Department of Public Health is reaching out to people who have recently tested positive for COVID-19 or who may have been exposed. If you tested positive, DPH will provide guidance on how to isolate and then help you identify recent close contacts so DPH's Georgia COVID team can alert them of their exposure. Your information and test result remain confidential per HIPAA. Learn more at dph.georgia.gov.
Gentlemen, thank you so much for joining me for the second portion, which is really engaging and conversation, certainly intriguing for me and hopefully our viewers as well. If you could, and both of you, we'll start Dr. Black, and then if we can transition over to Dr. Hurd. And you both have successfully, in my opinion, and eloquently shared the history of why there is some apprehension, Black or Brown communities, and we'll specifically talk about the Black community because of our history as it relates to healthcare and medicine within this country, and the treatment as it relates to that. One of the misnomers that I've heard or myths that I hear is that as it relates to this particular vaccine to counter COVID-19 is that they are actually injecting you or you would be injected with the actual virus itself. Speak to the composition and what the purpose of the vaccine serves and how it affects our bodies. Dr. Black?
Sure. I think that that is one of the common misconceptions that Dr. Hurd and I both hear. And I guess the easiest way to explain it is that although some vaccines do use live or killed agents or viruses, this is not one of them. This one actually targets proteins or various constituents on the surface of the virus in an effort to recognize the virus and help your body try to fight it. But there is no live or killed agent that is used. Now, two things that are important with that. Number one is when we talk about the speed, that has also been a concern with a lot of people. They get the vaccine too fast. But one of the reasons they were able to develop it so fast, they were not using live or killed agents. When you have to use those agents, you have to grow the viruses, then you run tests on them, and that adds the time and also in research and also production. So we did not have that as a barrier. The second part is to note that no one is injected with a live or a killed version of any virus on this particular vaccine. So that is not a concern. What we expect, or what certain individuals can expect, is some of the side effects that we see from the virus is that we're spurning or encouraging your immune system to recognize certain particles on the virus. And so you may therefore have some symptoms that are mild and short-lived. but it's not unexpected because we're trying to stimulate your immune system to jump into action. So that's a lot of people will say, yeah, I got ill after I took the vaccine, but it wasn't necessarily, you didn't get ill from the virus. You certainly didn't get the virus from the vaccine. There have also some people said, I got the vaccine and then I got the virus a couple of days later. Well, the vaccine played no role in that. It was just things happened at the same time, but were not related. So those are important concepts, but it is very important that people realize that the live vaccine is not used in the production and or development of this vaccine.
Very good. Dr. Hurd, would you like to weigh in as it relates to that?
Yes, thank you, Dr. Wilson. I would also like to add to what Dr. Black was saying. I don't even call it a side effect to the virus, to the vaccine. Okay, when we talk about a true side effect to the vaccine, we're talking about an allergic reaction or allergic response. So that's going to be shortness of breath, that's going to be swelling of the lips and tongue, that's going to be a rash. Those have been few and far between in terms of the number of those incidents that we've actually seen. What I like to talk about that patients are going to experience when they get the vaccine is going to be what Dr. Black talked about, the immune response. What you experience when you start talking about, I had a mild fever, I had body aches, I had a mild headache. That's actually your immune response to being exposed to the RNA from the virus. And again, as Dr. Black said, what we're doing is introducing the genetic material for a portion of the spike protein that's on the surface of the virus. We're not giving you the actual virus itself. And so people need to be aware that, one, you are not getting any form of the virus. You're getting a piece of a protein that's on the surface. That'd be like me showing you my bow tie and saying, here, this is my bow tie. This is not Derek Hurd. This is just the bow tie that Derek Hurd was wearing. And so by doing so, the body can still recognize that there's a foreign agent that's in it, and then it can go ahead and attack it. And by attacking it, what you have is a fever, you have body aches, you can have chills. The same response that you get when you are exposed to the vaccine. So again, I just like to make sure that patients are aware that we're not talking about true side effects, or we're talking about or an allergic reaction to it. Those have been extremely rare, few and far between. We're talking about the immune response that you have, and that does happen. I don't want people to go away thinking that you're not going to have an immune response. In fact, we hope that you do have some of an immune response, because that means that your body is working, your body is doing what it's supposed to do. So I tell people that, hey, if you have a little bit more of a robust immune response, that's okay. So if you develop a fever, that's okay. We expect that, we're okay with that, and that shows that your body is working and recognizing that there's something foreign in it.
Very good. Thank you so much for that. I've been having this ongoing conversation with my children. I have a 19-year-old and I have a 24-year-old, and I've been really surprised. A 24-year-old she's cemented on, I don't want to take the vaccine, and so I'm not sure where that has come from. Her 92-year-old great grandmother has taken it, and no side effects from that. I'm, excited, and whenever my opportunity comes available, I'm going to take it as well. And so what has surprised me about that is I would have thought that that mindset of, no, I'm concerned, it's going to bring additional harm or bring some harm to me, as, has been demonstrated throughout history. At times, not all the time, but there are some significant points in our history as African Americans where we have been devastated by that. And so I just would have thought that, just being a younger person, that she would think differently, and is certainly very well read. But again, it's a decision that we all have to make as individuals. I'm still encouraging her to do so. Have you gentlemen seen a theme? Do you see it in one demographic of our population more so than others, younger, older, or is it about the same throughout?
It's quite varied, and you'd be surprised. It's not among any particular group.
Mm-hmm.
I think one of the, if I may digress a little bit, I think one of the failures from a scientific and a medical community, one of the disappointments, as far as I'm concerned, is our inability to just pay attention to the science. And I think along with our response, a lot of it has been politicized, and along with that comes a lot of banter that people are exposed to. So I know one of the, your 19 and 24-year-olds certainly much more well-versed on social media than I am, and perhaps Dr. Hurd, perhaps you. So they get access to a lot of information much faster. And if it's coming from friends, just like it was in elementary school, if you hang around people that encourage you to smoke, you may start smoking because
Sure.
friends did. And if you're having that conversation with people, irrespective of their background, you may tend to latch onto it and it becomes difficult to unwind. The only thing we can do is encourage people to continue to look at trusted sources, pay attention, and think about the risks versus benefits. And it's been challenging because I will tell you, I have a fair amount of colleagues who are in medicine who say they won't take the vaccine. So it becomes a little, it's a challenge when we're not on one accord. But all we can do is present information and help people to make a decision that they're comfortable with, understanding the ramifications of deciding to or deciding not to. And you would have thought, I would have suspected that given our history, like I said, it being so early on and having such a devastating effect in our community due to the virus, that we would have had a much larger compliance or a much larger amount of people wanting to get the vaccine than we did. And it's even among the people in the hospital where we did, I think, a magnificent job of taking care of a lot of sick people, but there's still a lot of people who are uncomfortable with getting the vaccine. So it's something that we constantly have to address, acknowledge, and again, have the conversation. We're constantly saying, let's talk about it. What are your concerns? And trying to break down some of those barriers. And we find people that come across it, like Derek mentioned earlier. I had a couple of friends of mine in a doctor's lounge. They said, Eddie, hey, we understand you're the first one to get the vaccine. We're going to wait and see if you're alive in 6 weeks, and then we'll think about getting it done. So as Derek said, I'm happy to report I'm still alive. So I'm hoping that they're feeling more comfortable with that. But, we saw it when in the military, back when I was in the Navy, when we were rolling out vaccinations against smallpox and against other diseases. And there's a lot of apprehension because of the amount of information that people have access to. Some of it factual, some of it not, or some of it less so. So it's just an information stream we have to continue to fight. But one of the things I like to leave people with, and I'll leave it alone, I'll ask, how many of you guys have ever had polio? How many of you guys had smallpox? How many of you guys know somebody's had meningitis? And, the number invariably is zero, although some people have had meningitis, but a lot of these diseases are no longer prevalent because of vaccines. So the list goes on, and I can rattle off about 10 or so that tell the things they don't see because our parents and grandparents chose to get vaccinated. So I think it's important for us to understand how this can be very helpful. And, I've reconciled the fact that I have chosen to continue to take care of a very sick population, and I put myself at risk.
Sure.
What I don't want to do is say I had the chance to do it, and it's something I could have done that might have reduced my risk, or God forbid, having me infect somebody in my family that I love, and I chose not to do it. So those are the decisions that weighed in on me deciding to get the vaccine. I try to relay that to patients and other individuals who have questions about it.
Well, hopefully we've convinced some individuals, a large number too, who have not or who were teetering on whether I should take it or not, convinced them the importance and the value of taking it, and provided some extensive or enough information for them to be to make a decision that not only impacts their lives directly, but those that surround them. Before we wrap up and share with viewers where they can go to receive their vaccination and that process, I would love to know from both of you how this whole experience has impacted you as men and then also as medical professionals.
Well, I would say that, and I think I mentioned this earlier, that I contracted COVID in November. And I had what would be considered a moderate case. I had to end up being hospitalized for a few days because of it. But thanks to the Lord, I pulled through, and thanks to my colleagues at Phoebe, who took great care of me. And I had access to some wonderful medications to help me treat it. And so I'm still here. So I'm thankful for that. So I will say that, I need to make sure I point this out, that, it's a numbers game. And when people talk about, well, I'm nervous about getting the vaccine, or I'm nervous about getting, because I don't know what's going on. I would say, well, how many people have died from the vaccine so far? Now, juxtapose that with the number of people that we know that have died in less than a year in the United States alone from COVID. This past weekend, we hit that terrible milestone of 500,000 people have died from the virus. I don't care what kind of website you're going to. they're not going to be able to list 500,000 people that have died from the vaccine being administered.
Sure.
And so it's just a sad fact of this, that you can believe some of those things on some of these social media sites, but the sheer fact that sheer numbers tell us that you're more likely to die from actually getting COVID than you are from getting a vaccine for COVID.
Certainly.
So please look at that. In terms of how that has affected me as a man, again, I could have lost my family. You know, I could not be here having this conversation with you today because of that. And that becomes sobering. And I try not to think about it a lot, but it's sobering. You know, there was a very strong possibility I would have made it. I have sickle cell anemia. So that puts me in a high risk category when it comes to severity of COVID illness. And so for that reason, it was very scary. It was very sobering. But again, I pulled through it. As a healthcare provider, it has been difficult because I'm sure Dr. Black will share this as well. You know, we have people that we grew up with, people that we went to college with, people that I've known my entire life that have succumbed to this virus. And that's hard. You know, and it's hard to feel as if there's not a whole lot that you can do to stop people from getting it. So we've been doing the things that we're doing now today. We're talking with you. We've done numerous town hall meetings on Facebook. We've spoken to church organizations. The work that we're doing for our organization, we're doing that because we have borne the burden of seeing friends and family members and loved ones die from this illness. And it's preventable. And that's the thing that I think hurts me the most, is that this is a preventable illness. You know, if we wear our mask, you know, and the CDC is now saying that we need to wear cloth masks that have multiple layers, or if you don't have a multi-layer cloth mask, that you need to double mask with a procedural mask and a cloth mask. Or if you have access to an N95, wearing that in public, but wearing those things in public, washing your hands, and then socially distancing. I know that as we're talking to Albany State University and the students at the university. And so part of that feeling is that I'm invincible, that I can go out and I can do these things. But I just need you to understand that this disease does not care how old you are, doesn't care what color you are, doesn't care if you're male or female. It can affect you. And if it infects you, there's a possibility that you can die from it. So just do the things that are necessary to keep yourself from getting it. Because at the end of the day, we all want to go back to going to Albany State football games. We want to go back to being able to go to movies and go to restaurants and enjoy ourselves. But we can't do this if we're all going in different directions, if we're being pulled in different directions. You have some people that are taking care of themselves and other people that are not. We're only going to get past this if we're all rowing in the same direction. And science and medicine are telling us that we need to row in the direction of taking a vaccine, washing our hands, socially distancing, and wearing masks. That's where the science is pointing us. This isn't about our personal feelings. This isn't about our political leanings. This is about what science is telling us. And so I just want to reiterate that. Listen to science. Don't listen to auntie. Don't listen to grandma them. Don't listen to whatever website you're on, Savoy Show website, and thinking that that's going to be the end all when it comes to medicine. Listen to your healthcare providers and go to reputable medical sites when they talk about and give you political free and bias free information on the virus and on vaccines.
Very good. Thank you so much for sharing your story, Dr. Hurd. Dr. Black, your personal and professional experience throughout this ordeal before we wrap up?
Sure. You know, I think as I was looking back for the past, I guess, couple of decades, maybe a little bit more, as part of the work I do, I actually do teaching around the country and internationally on hospital preparedness and disaster preparedness. And one of the things we often do is we look historically things that have happened. And I recall very distinctly in January of last year, teaching up in New York City and referencing the Spanish flu outbreak in 1919. And I had one of the gentlemen in our office said, "You think that ever happened here?" And I said, "Are you paying attention to what's going on in China with coronavirus?" "Well, that'll never come here." I said, "But what if it did? What happens?" And then it does. And so I think about, you know, as you sit back and as Dr. Hurd said, this thing has been very sobering. We've lost a bunch of friends. We've lost a bunch of loved ones. We know people who have lost several people in their family.
Yes.
It becomes very sobering. You kind of look back and for me, in a way, it kind of became very clear of why I'm here. I think my experiences teaching this, my experiences being able to help and being kind of one of the areas that was hit hardest, you know, it brings into focus, this is why I'm here. This is why I'm home. And it's very, on the one hand, it's unreal to see a lot of people that have suffered, lost their lives, and continue to suffer from it. But on the other hand, there's no place that I'd rather be rather than right here doing this. And this is why Derek and I chose to work almost every single day in an effort to help treat our friends, our family, and our community. And so that's why we'll continue to have these kind of conversations. I'll continue to try to share any information I know, good, bad, or otherwise. And but I am also well aware that the only way our community has done so well is about the help and cooperation of the citizens and the patients here. And without them actually, this is being a very collaborative effort. I'll share what I know, good, bad, or otherwise. You share your feelings, we'll talk about it, and we're going to get through it. I think we're going to continue on that, and that's going to be our guiding edict. We're going to make sure that we share information. We're going to continue to encourage, and we're going to continue to take care of each other. So it's been one of those life-changing things that we never thought we'd have to come to face, but it's the hand we've been dealt, and we're going to continue to face it head on. So like Dr. Hurd, we're going to follow the science. We're going to protect our community, and we're going to win. We're going to prevail.
Well, thank you for ending on such an encouraging note. Thank you on several different fronts for successfully informing our viewers about the ramifications of not taking the vaccine in comparison to taking the vaccine and following the science, and just those fundamental expectations that we all should have for one another, and holding one another accountable with just the basics of the mask, of social distancing, and then certainly washing our hands. Just being proactive. I keep hearing, when are we going to get back to normal? When are we? And here we are a year later. And even when we get to some semblance of normalcy as we once knew it, just again, taking those measures to remain safe. I think a lot of the practices that we've heightened as a result of this need to continue on. Thank you for what I know President Federick would want me to say, being exemplary alums of Albany State University and representing on an international front the fine individuals that we produce each semester in the form of graduates and world-class contributors. And you certainly have evidence that I'm certain before this epidemic, but certainly throughout. And so we are extremely proud and thank you for unconditionally giving of yourselves as it relates to your profession and certainly to your community. As the changes continue to occur, you're welcome to come back and share with us. And once we get on the other side of this, celebrate the achievements as certainly on the medical front, but what we've done as a community to overcome this pandemic.
Thank you so much.
Yes, thank you.
My pleasure. Viewers, thank you so much for joining me for this special edition of Realizing Potential. I'm Wendy Wilson. We encourage you to continue to stay informed, to take advantage of the vaccine, stay in contact or make contact with your medical professional or clinician about what you need to do and the steps you need to take to stay healthy. We look forward to seeing you next time.